So I can't really remember what my perception of being a doctor was when I was younger. It was certainly a combination of science and caring and helping people. But I think what motivates me is finding those little small moments of kind of reassurance that you're doing a really good job. You could be caring for, anywhere between 20 to 40 people a day, but it's difficult to maintain when you've got a million things swirling around your head. You could have had a really tricky conversation with someone, and then the next minute you've got to kind of go in and be really positive with another patient, or again, deliver some difficult news. Being able to talk to anyone about anything is a skill that will stand you in great stead for any career, but in particular being a doctor. I think if you're passionate about it and you like helping people and you're very people orientated, then medicine's certainly a great career. Every day's a school day, you're constantly learning.
Welcome to our Diary of a Future CEO series with inspiring stories to ignite the next generation. Today we have a very special guest, Amelia, who's a resident doctor right in the heart of it, balancing patient care and personal growth in the unique and exciting setting of the National Health Service. So if you're interested in a career in medicine, this episode promises to be inspiring. Amelia, thank you for giving up your time to be here today. What first inspired you to follow a career in medicine?
So actually, when I was a lot younger, I really wanted to be a vet because I really liked animals, really cared for them. But I think that kind of faded out as I kind of became aware of a career in medicine. And I realised medicine was a lot more people-focused, and there's a lot more communication and ability to have those difficult conversations with people. So that kind of made me think about, maybe medicine is for me. And then my real interest was sparked with actually psychiatry and all to do with the brain and mental illness. I just found that absolutely fascinating. And at school, I started to really realise that the brain was what I was most interested in. So I'd say kind of from year 9 onwards, that's when my interest in medicine really started to take off.
Tell me about what you're doing at the moment.
So currently I'm working as a junior doctor, or I should say resident doctor, that's the new term, in Oxfordshire. So I'm working across a couple of different hospitals in Oxford, working in psychiatry at the moment and also in surgical emergencies. So 2 quite different things, but I split my time across the 2 kind of units at the moment.
Can you give us an idea of what a typical day looks like for you?
So probably easier to talk about the surgical emergency unit, which is what I'm working on. That's a more typical role of kind of a doctor. So in the morning, get to the hospital for about 7:45, and then at 8 a.m. you have a handover, which is where all the doctors meet, including the senior doctors and consultants, and they'll talk through all the patients that have come in overnight or new patients that we have to see. And then you split up into your teams. So I work in a specific ward on the surgical emergency unit, and I'll go around with one of the more senior doctors, usually a consultant or a registrar, and we'll see the patients individually and we'll come up with a treatment plan for that day. And then it's my job to action all those plans for the day and keep that patient safe, order all the kind of blood results, scans that they might need, and then action anything that comes of that, if that makes sense.
How is it different being on the wards as a doctor compared to when you were at university?
So it's very, very different because obviously you have so much more responsibility, and these are actually your patients that you're responsible for day to day. And at medical school, you could kind of come in for a morning if you're on placement, see a few patients, see the really interesting cases, and then go home and study. And you don't actually have to see anything through and action all those plans that the doctors come up with. So the responsibility is certainly a lot more, and naturally it's a lot more stressful and demanding, and you have to manage your time a lot better.
How do you get that balance between your own professional development in the role, but also patient care?
So I think it's about taking the opportunities for self-development when you can. So to be honest, at the moment, doctors are so busy at my level that we don't have so much time for that. But if you have a quiet afternoon, you can really pick the older doctors' brains about a specific case if you're really interested. And on my unit that I work in, you can attend theatre and scrub into different cases that are really interesting if you have the time. But I think that's something that's quite opportunistic. So you just kind of take the opportunities where you can, really.
What is it about your role that kind of motivates you every day?
I think that's tricky because at the moment, it's quite easy to feel quite overwhelmed by things because everything's still quite new. I'm in my first year as a doctor and I'm still learning so much every day. But I think what motivates me is finding those little small moments of kind of reassurance that you're doing a really good job, or if you explain something to a patient or their family really well and you feel like you've taken the time to do that in a really empathetic manner, that's so rewarding because then the patient is able to kind of look you in the eyes and say, oh, thank you so much for that explanation, or, I really appreciate you taking the time to do that. So there's no kind of big grand motivator. I think it's all about the little things that you can find in every day.
It's really interesting that you mentioned empathy then, because I always think when you're sick, you have to put immediate trust in your doctor and you really need them to have that empathy and just understanding and like that care.
Yeah, it's definitely, it's difficult to maintain such a genuine empathy with patients as well, because you could be caring for, anywhere between 20 to 40 people a day, and each interaction you should be bringing a really empathetic and patient-centred approach. But it's difficult to maintain when you've got a million things swirling around your head and lots of jobs to keep doing throughout the day. So I think a skill that I'm continuing to work on, that I'm trying to develop, is kind of compartmentalizing. You could have had a really tricky conversation with someone and then the next minute you've got to kind of go in and be really positive with another patient, or again deliver some difficult news. So kind of taking a moment to breathe, differentiating between the past 10 minutes and into your next is a skill that I'm kind of continuing to work on.
I always imagine that must be one of the hardest parts of the job, when you just have to tell somebody something that they don't want to hear.
Yeah, it's really difficult, and I think the only way you improve those skills of delivering bad news is by watching other doctors that do it really well. So I've spent quite a lot of time with the palliative care doctors, and they're just like the master communicators. They're amazing, and they can deliver news in a direct way and understand that the patient needs to hear certain things about prognosis and the next steps, but also maintain such an empathetic tone throughout, and also be able to deliver the news in a different way depending on what different patients want, if that makes sense. So some people want a really direct doctor that just tells them how it is and doesn't kind of float around the subject, whereas other people want just the bare minimum news and nothing too distressing, just to get them to kind of understand what's going on so they can move forward. And catering that to different people is such a skill that you kind of develop intuitively as well.
You mentioned the skills that you develop there. What skills do you feel that you absolutely have to be a junior doctor and follow that career path?
Time management, definitely, which is something that, again, is an ongoing thing. I'm not going to claim to have mastered it by any means, but that's certainly one. And then communication. So being able to talk to anyone about anything is a skill that will stand you in great stead for any career, but in particular being a doctor, because you come across people from all walks of life and people that have been perhaps raised in a very different culture or religion even to yourself, and you have to be able to communicate with them effectively and understand where they're coming from on certain issues, certain treatments that they may or may not want, and being really understanding, non-judgmental and open in your communication is something that's just invaluable being a doctor.
And I imagine that's not really something you can learn in the classroom when you're at university. It's very much on the job.
Yeah, certainly. I think at university we have lots of simulated scenarios. And our final exams are called OSCEs, which is Observed Structured Clinical Exams. So they get actors in and they have fake scenarios that they'll do. And it does work at working on your communication skills and how you deliver news and things like that. But there's nothing compared to when you're actually telling someone, some really bad news or even good news. There's nothing that prepares you until you actually get to that point and you're sat face to face with the patient. So, every day's a school day, you're constantly learning.
Without breaking any confidentiality, have there been any sort of stand-up moments for you with your maybe interaction with patients or other doctors, maybe more senior doctors that have mentored you or indirectly mentored you?
I've definitely had some positive feedback from doctors when they've observed you, but at kind of a resident doctor level, there's not so much direct observed feedback from seniors. But in my psychiatry job, there's certainly a lot more of those difficult family conversations. I work with older adults at the moment, so there's lots of people with dementia and Alzheimer's diagnosis, and having these conversations with families about forward planning and disease progression can be really tricky. But I think if done in the right way, families can actually appreciate it so much, because there was a certain situation where one family member of a patient of mine was really upfront and direct and wanted to know kind of where the disease was going from there and how their relative was likely to get better or worse and in what way. And another family member really didn't want to know anything at all. And that meant that when everyone came in together, you couldn't really hit the mark with what to explain, but actually taking the family member that wanted to be a bit more direct to one side and explaining fully what was going to happen was so beneficial to her. And she really thanked me, and it was a very emotional conversation from her side, but she really thanked me for just being so transparent and upfront and not kind of concealing things from her, because that was helpful for her to kind of understand what was going to happen in the future. So that moment was really important for me, because it kind of told me, actually, I'm doing a good job. I'm good at communicating in this way. And hopefully that was helpful to her.
Wow. I mean, dealing with dementia patients must be so difficult. I visited a friend recently who had dementia, and I literally cried the whole way home. Do you ever just feel like that? Does it ever just become overwhelming?
It certainly can. Like when I first started, it was very overwhelming, because I think you kind of parallel it to people in your life, or, you know, if my relative was in that position, how would I want them to be treated? And it's naturally quite sad. And I think that's an element of psychiatry which I don't think I could take forward as a long-term career for that reason, because it's quite emotionally loading and it's hard to not take everything home with you. But I think what makes it slightly easier is just remembering, hang on, well, if I had a relative in that position, how would I want them to be treated? What would I want the doctors to be doing? So in a strange way, it kind of helps you to be better, because you're able to carry on working really hard and not letting the emotions of the situation get on top of you and prevent you from doing your job in a really good way.
Amelia, what advice would you have for students who might be watching or listening to the podcast, thinking about a career in medicine themselves?
Spending time with people that are doing the job, talking as much to doctors kind of at all levels, so both at a resident doctor level and a more senior level, about their role, what they enjoy, and perhaps what's really challenging, so you can have a realistic view of what being a doctor is like. And then I know I keep going on about communication, but really just getting out there into the world and talking to people, because I certainly found, coming from a very lovely upbringing in quite a sheltered environment in Cambridge, to going out, and I studied in Nottingham, to meeting the patient population there and being able to try and talk to people, as I mentioned, in a non-judgmental and open way, is such a good skill. And I think if you can master your communication with people from all walks of life, it'll stand you in really good stead. So yeah, just getting out there and experiencing things, talking to people and engaging as much as you can with doctors, asking them about their role.
And how different is being a doctor to how you imagined it to be all those years ago when you were still at school?
So I can't really remember what my perception of being a doctor was when I was younger. It was certainly a combination of science and caring and helping people, which still rings true today. But I think there's a lot more about time management and dealing with the stresses of everyday work, and the time pressures that come with working in the NHS as well, that kind of ring true to my everyday job. But actually I think that's more on a junior level, and I think as you go through, you're able to make a lot more decisions as you get more experience and clinical understanding of things. So I think it's different at the moment in terms of what I'm actually doing day to day. And although I am making clinical decisions and actioning plans, it's less kind of patient walks in, you diagnose them, you treat them, they go home and they get better. It's a lot more nuanced than that. And actually there's a lot more of the kind of people skills that come into play, I think.
I can tell that you are a brilliant doctor. Just your people skills are brilliant.
Oh, thank you.
What are your future aspirations then?
I've recently become more interested in paediatrics and working with children. So that's kind of the main focus of my future at the moment. But I'm still open to lots of different medical specialties, and more senior doctors always tell you don't be too set on one path, because you'll change your mind a million times before you actually get to the point of specialising. And I think that really is true from what I've seen in all my friends that are doctors as well. You change your mind so often. You can have a really good experience in one specialty and decide that's the new passion, and then the next week actually have something less good and think you want to do something else. So it varies a lot, but I think paediatrics is a real focus for me at the moment.
When do you have to start making those decisions, or does it not really work like that?
So you rotate for 2 years as when you first qualify out of university, and you kind of do lots of different jobs, rotate through different areas of the hospital, so you get a feel for different specialties. And then you can either go straight into a training contract of normally 7 or 8 years in a specialty, or you can choose to take some more time out and do what's called locum work. So you could work for just 3 months in one specialty and just get paid as you go kind of thing, without committing to a whole year. And then you can do that for as many years as you want, really, before you decide to specialise, which I think is nice because it means there's no time pressure on it and you're not forced into a decision that actually you may come to regret in a few years' time.
What advice would you give to a young person who wants to follow the same career as you?
I think if you're passionate about it and you like helping people and you're very people orientated, then medicine's certainly a great career. I think research as much as you can, all the different specialties. Although being a doctor, there's similarities across lots of different specialties. Actually, the role of a GP is very, very different day to day to the role of a surgeon or a psychiatrist. So there's lots of different avenues you can go down, and actually your day-to-day life can look very different. So if you're interested in medicine and helping people, then it's certainly a great career, and it can look very varied. So, most people that are interested in science and helping people could be a great doctor.
We always end our podcasts by asking our guests if there's like a quote or a memorable phrase or just something that they kind of live by that they'd pass on to others. What would yours be?
It's not applicable to everything, but something that I certainly have told myself over the years when dealing with hardships or if things aren't quite going your way is trying to tell yourself that everything happens for a reason. I think as much as that can't be applied to more serious scenarios, in your everyday life, if things aren't quite going the way you want them to, you may not see it at the time, but there's probably a lesson there. And further down the line, you'll be able to see kind of why something happened or why something played out the way it did. So yeah, everything happens for a reason is what I would say.
Thanks very much, Amelia.
Thank you.